Do you suffer with heel pain or plantar fasciitis? Make sure you watch this video because we're going to tell you why you get it, what it is, and our top tips so that you can help it straight away. And then if it's really not working, then we've got a great offer for you. So heel pain at the end of the day is primarily, in most cases, plantar fasciitis. There's usually a few different things going on in the heel for it to hurt like that. But primarily what heel pain is that your plantar fascia runs from here down to here, all right, and it's caused by micro tearing through this area here. And you might see a few of my helpers walking through the video today, very helpful. But basically what happens is that the plantar fascia runs from here down to here, and you get this micro tearing through this particular part, which is around your heel, which is the attachment point through the heel of the medial calcaneal of your tubercle, which is primarily your heel bone. So what happens is in the way you stand, the way you walk, you cause tearing through the plantar fascia. That bleeds and it gets sore, and it usually manifests itself around that heel, resulting in heel pain. So some of you might be thinking, well, how come it's called a heel spur, or I've got a spur? So the reality is that, you know, roughly 70% of the population may have heel spurring through this particular area here. But what we actually do find is it's not the heel spur that causes you pain, it's the plantar fascial attachment, if we're being technical. I guess at the end of the day, who cares? Your foot hurts and you want to fix it. So we're going to show you how to do that. You might say, well, why does this happen in the first place? So the reason this happens in the first place is because of two main reasons. So probably 30% of your problem is tight calf muscles. So your calf muscle comes down here, attaches into here, and pulls on the plantar fascia and increases the tearing. And then I'm going to use that in a moment, mate. And what I would also say is that, so it pulls on and increases tearing, and also the way you stand and the way you walk also affects that as well. So they're two big factors to take into account. What we're going to show you today is that I'm going to show you the top 3 things that should help with your heel pain. And we use them all the time in the clinic, and they're usually very, very successful. So just for the record, sometimes you do need professional help. You can't just fix your heel pain with just exercises. So please be aware of that. So I would suggest you do these. You do these for about 3 weeks. If you're not getting symptomatic relief within 3 weeks, then I would definitely take us up on the special offer that we have at the end of this video. So the first one I would start doing is stretching your calves. Thank you, Harvey. Very good help. So the way we do this one is we're just leaning in like so. Hold this for 30 seconds, and you want to do this 3 to 5 times a day. So the advantage of this is that what you're doing is you're loosening up your calf muscle, so you're taking away that tension through that particular area. The next one is the dowel exercise. So any of you who have ever tried this, you'll realise that it hurts a little bit. So what we do is we walk along, and when we hit a sore spot, 1, 2, 3, 4. What this is doing is it's breaking up that tightness through that area. What I would say is keep in mind, if it really, really hurts doing it 2 feet, why don't you try doing it 1 foot at a time and taking your body weight on a table and a chair, a bit like this. So what this is doing is it's rejuvenating and loosening up that plantar fascia and rejuvenating those cells. But just remember, if this hurts too much, maybe look at some of our previous exercises, and we'll where we go through our tennis ball, and that's a little bit of a lighter exercise, okay? And the final one, so keep in mind that the dowel and this particular exercise are very, very well proven. So the way we do this one, put your toes up on a towel like so, and go down, 1, 2, 3, and then up, 1, 2, 3. And then down, 1, 2, 3, and then up, 1, 2, 3. So it's very important that you flex your big toe on a towel. You might say, well, why? Who cares? Well, what it does is it turns on all of your arch and your ankle muscles and puts tension through the plantar fascia that strengthens those particular areas. Very, very well researched and well proven, so I'd strongly urge you to use a towel when you do this exercise. What I would say is if any of these exercises flare you up, please contact our clinic immediately, and we can give you extra assistance. What I would also say is keep in mind, if you don't get symptomatic relief within 3 minutes, what I would say is that please try and make an appointment. At the moment, we've got a very special offer, 65% off initial assessment offer for heel pain. Thanks very much, and I hope this was helpful.